Ladies and gentlemen, welcome to the Parkland Health Foundation's President's Reception. To kick off our event this evening, please welcome to the stage Michelle George, Vice President, Community Relations Manager at Bank of Texas, and member of the Parkland Health Foundation Board of Directors.
Thank you all for being here today. What a beautiful turnout, and thank you for inviting me to be up here to speak with you today. I'm so excited to be celebrating the 40th anniversary of the Parkland Health Foundation. Let's give these guys a hand. For 4 decades, Parkland Health Foundation has played a vital role in strengthening our community, supporting programs, services, and innovations that ensure quality health care is accessible to everyone in Dallas County. And as a board member, it's inspiring to see how this mission continues to grow and touch more lives every year. And I'm not only a board member, but I have a personal connection. As the daughter of a health administrator and a nurse, and a former recipient of medical philanthropy, this cause is especially important to me. And at Bank of Texas, we are proud to stand alongside Parkland in the life-saving mission, knowing that together we can make a lasting difference in the health and well-being of our community. Supporting Parkland builds a stronger, healthier Dallas County. Thank you.
I support Parkland Health Foundation.
I support Parkland Health Foundation. I support Parkland Health Foundation.
I support Parkland Health Foundation.
I support Parkland Hospital because a city or a county has to have a great safety net hospital to realize on the business, health, and quality of life objectives it set.
The Mammogram Poster Girls supports Parkland because of their dedication to high quality, compassionate care for every patient, regardless of ability to pay.
I'm passionate about Parkland because why not? Parkland is a great institution in the city of Dallas. It supports so many programs. It has wonderful surgeons, affiliated staff, support groups, patient base, and why not support a great institution that only makes the city of Dallas better every single day.
I'm passionate about Parkland because I love the way that they view each patient as a whole person, not just as a body to be treated or a list of problems or symptoms to be dealt with, but as a person with family and friends and a life and hopes and dreams, and they minister to every aspect of that. I'm passionate about Parkland because the story of Parkland is deep in my family and deeply meaningful to me. My mother was a registered nurse in India and was recruited to fulfill the nursing shortage that was happening, along with many of her friends, and Parkland was the home. So the reason I'm in Dallas and why I was born and brought up here is because of Parkland Hospital.
I am passionate about supporting Parkland because they are the heart of the Dallas County. You know, when Parkland cares for our neighbor in need, they lift the entire community. Parkland reminds us that the true strength is found in compassion. And when one life is healed, we all are made stronger.
Supporting Parkland builds a stronger, healthier Dallas County.
I came to Parkland in 1980, and there was quite a bit of conversation that we could get more donations, bring more people on board if we had a foundation. And we needed that foundation because there was so much we wanted to do. And tax dollars wasn't able to provide what we wanted to make it the best. And thus we worked very hard to get this foundation, very hard. To move from that to where we are now, where we are celebrating in so many different ways the opportunities we have to tell the story. But keep in mind, we couldn't tell the story if we didn't have something to tell. And so the foundation provided the venue to tell our story and to get other people to join in with us. There's very little on this campus right now that in some way did not have the imprint of the Parkland Foundation in support of it.
The Parkland will continue to be an anchor for the Dallas medical community. It will continue to be an excellent safety net educational hospital, that there will be a future generation of outstanding young physicians who cut their teeth at Parkland and who remain incredibly loyal and grateful for it. And that it will also be there for the patients and the families that need that excellent care, and that will continue to really innovate and find ways, even cooler ways for safety net hospitals to deliver excellent care, because that's really what it's been doing for 40 years.
I think one thing that I learned through my time serving with the foundation is not just the community access and sort of the healthcare for all, but the centers of excellence that are here at Parkland Health. And so no matter if you have insurance or don't have insurance, if you are in an accident and you need trauma care, you want to be taken to Parkland. If you unfortunately are a burn victim, you want to be taken to Parkland. I enjoyed learning about those centers of excellence and really seeing the foundation help stand those up and communicate those to the larger community.
And one of the things that is so dear to me that I tried to articulate to the leadership of Parkland and the colleagues, the dear colleagues that I worked with, is that I spent a lot of my career in church work, but I have never seen an organization doing the work of God so profoundly, 24 hours a day, 7 days a week, than Parkland Hospital. And to me, that means everything.
For safety net hospitals, really for all hospitals, healthcare is an increasingly difficult business. For Parkland to maintain its history of excellence, it's going to require philanthropic support from the community. And quite honestly, I think it has a proven track record of the return on investment that it does with philanthropic dollars, creates real value for our community. And I think it's just as fine as an opportunity for philanthropy as there exists in our community.
The success of the other hospital systems in our area is dependent on having a successful Parkland. It is an ecosystem of all of the healthcare entities all kind of rowing in the same direction. And for that, I'm so thankful that we have a strong community hospital like Parkland.
I would ask all within our community to keep their eye on Parkland and to say within your soul, I stand for Parkland, and do it. Because that organization needs the support of everyone in the community, politically, philanthropically, spiritually, morally, ethically, and it needs us all, and it deserves us all.
Now, please welcome to the stage Parkland Health President and CEO, Dr. Fred Cerise.
Hey there. Let me start by just welcoming everybody tonight. Thank you for being here. Just watching that video, this is such a special place. This place is a unicorn among public hospitals, I'll tell you. And it is because of the support we get from the community. And so before I start, I saw Commissioner Garcia here. Thank you for being here and for appointing the board members that you appointed. For the other commissioners that do that, we can only do the work we do with the leadership that we get from the community. And I know we've got a number of current and former board members here. So if you guys would just raise your hand so people can acknowledge you. Whole table right there.
Thank you, guys.
It's such a pleasure to join with this group that shares Parkland's mission and caring for our community. And seeing the video reminds me of something that I see every day at Parkland. And it's not a story about a health system, but it's about the people. It's about generations of families and community and about the way that philanthropy, your philanthropy, has changed lives at Parkland and in Dallas. You know, healthcare today is complicated, it's expensive, it's confusing, and even among those of us with ample resources, it can be very difficult to figure out. Um, Many of our patients, they just struggle with the necessities of life before they can even think about their healthcare concerns. And at Parkland, we work every day to try to relieve that burden, to provide healthcare that is affordable, it's accessible, and it meets the highest standards of care, not to sacrifice a level of care because of who we're taking care of, but to raise the level because of who we're taking care of. You know, that commitment at Parkland is not rooted in, uh, it's not new. It's rooted in a legacy that stretches back for over a century. And I'd like to just take a moment to reflect on some of the decades of care and compassion and community that Parkland has brought to Dallas County. You know, over the last 130 years, Parkland has become more than a safety net county hospital. It's a global leader in innovative care with decades of impactful work that has changed modern medicine. You may be familiar with the Parkland burn formula, just for example. Developed here decades ago, remains the standard worldwide for treating burn patients. In fact, if you watched The Pit last season, you might have heard it mentioned on The Pit. Tells you how well it's acknowledged. But more recently, our advanced analytics team at the Parkland Center for Clinical Innovation, they've been ahead of the curve in so many ways. We're able to predict right now patients at risk for adverse events and intervene to prevent bad outcomes before they happen. And then simple population-based approaches, like those developed by our partners at UT Southwestern, our OB team there, where they hand deliver iron tablets as part of a multivitamin to every pregnant woman. And that's been proven to reduce anemia and blood transfusions at delivery and prevent neural tube defects in babies. And those are things that will change practices across the country. And so we continue to provide innovative ways to deliver the highest levels of care. Just last week, Parkland achieved magnet designation with distinction. So a lot of you know what that means. This is from the American Nurses Credentialing Center. It's a prestigious award that puts Parkland among the top 1% of healthcare organizations in the country for exceptional nursing care. So from women's health to trauma to emergency medicine, Parkland has been a formative place for teaching practices that have been adopted not only throughout the nation, but throughout the world. And moving forward, we're focused on what matters most to our patients, and that is expanding access and removing barriers to care. You may know right now there's a 22-year difference in life expectancy between zip codes in southern Dallas and neighborhoods just 4 miles away. Parkland's community health centers bring healthcare directly into Dallas County's most underserved neighborhoods with 16 clinics across the county. We provide additional care through mobile units and in partnership with community-based trusted organizations that will provide partnership with us to serve patients. And because of your support, we're bridging the gap in these health outcomes. Families that would otherwise not have access to care can now easily get care, everything from their flu shots to counseling to medications to complex specialty care, and they're living longer because of it. We all know what it feels like to be anxious about our own health or a family member's health. Now imagine if you have that anxiety and those healthcare needs and you don't have options for care. Or if you feel like the care that you can't access is some lower level of quality that's available to you but not available, that's some lower level that is less than what other people may have access to. And that very concern, I can tell you, that fuels so many people, that drives us at Parkland. You know, our patients, they feel pain, they bleed, they feel anxiety about their health, just like everybody else. You know, when the president is scheduled to be in Dallas, we get a call several days ahead of time, and we have an operating room on call, on hold, God forbid if that's necessary for care. And we take great pride in knowing that those same doctors, those same nurses and techs that would take care of the president are here every day taking care of the low-income workers that don't have health insurance or the homeless person who would not otherwise have access to the care that they need. And that's why the work we do together matters so much. And what the Parkland Health Foundation has achieved in the last 40 years continues to prove that public health care can exceed the traditional expectations, delivering compassionate care every day. And that's done in large part due to the generosity of you and the larger Dallas community. So, on behalf of the doctors and nurses and every member of our staff, and most importantly, every patient whose life has been touched by Parkland, thank you. Thank you for your care, your compassion, being part of this community of hope and healing. Together, we're building not just a health system, we're building your health system, the health system for Dallas County, your community of care, and a health system like no others that cares for all of us. And that's not an exaggeration. This really is a unicorn in the place of public health care in this country. I can't wait to see what we can achieve together in the years to come. And now it's my honor to welcome to the stage, where is he? Our Parkland Health Foundation President and CEO, and my good friend, Dr. Michael Horn.
So excited that we're able to jump off there. Good evening, Parkland. Oh, no. So this is a homecoming. We are on the main campus. We are home. So let's try it again. Good evening, Parkland. Wow. I would be remiss because, the reality is to get us to this place, to turn the magnificent and magnanimous Moody Outpatient Center into an event space takes a lot of coordination and a lot of work. And so please join me in just showing some gratitude for all of the Parkland employees and vendors that really worked tirelessly to put this together. This is amazing. It is so extraordinary to be here. And Dr. Cerise, I want to echo what you shared, and that is we are truly and deeply grateful, right, that everyone has come tonight back to Parkland to celebrate the best of who we are in our community. I have to say that, seeing the video and hearing you, Dr. Cerise, reflect on what Parkland has achieved, thanks in part to philanthropy, it's hard not to feel humbled and energized, right, when you see the sentiments and hear the accomplishments that we have been able to bring together. Because, what we're doing tonight is not just celebrating Parkland's past. It's really celebrating the future of what we are building together. As Katie Robbins mentioned in the video, Parkland truly is the bedrock on which the success of the entire medical landscape of North Texas relies. I'm going to say that one more time because I think that is truly important. Parkland is the bedrock on which the entire medical landscape in North Texas relies, right? We're at the epicenter of what we see here across our community. The theme that you heard tonight, right, this evening, Bridging Gaps, captures so much of what the Parkland Health Foundation stands for. We bridge today's challenges with tomorrow's innovation. We bridge people and resources to create something bigger than ourselves. And at the heart of it all, we bridge the gap between access and need. Now, in case you've not already noticed the remarkable statistics that are smattered across this wonderful facility, we have some pretty big numbers that we want to celebrate. In the past 40 years, more than 50,000 generous donors have invested more than $483 million to support Parkland. That deserves a round of applause. That's the community. And as we reflect on those numbers, I want us all to think about where we were 40 years ago and think about where we are today, thanks to donors like you. New Parkland, the Moody Outpatient Center, expanded community health centers in neighborhoods across Dallas County. These are transformative shifts that mean a mom can receive a home visit from a nurse weeks after delivering. A child can be accessed and diagnosed with autism, opening doors to resources. And a father with high blood pressure can get regular health screenings minutes from home without taking time off from work. These are just a few examples of the ways in which Parkland continues to bridge the gap to accessible healthcare and a thriving Dallas economy that would not have happened without the passion, the vision, and the generosity of this community of supporters. And that's why tonight matters, because you are not just donors, you are leaders sharing the future of healthcare across Dallas County. You are helping to ensure that Parkland isn't just a health system, it's your health system. It's your community of care. And as your health system, Parkland defines this new exciting chapter for caring for those who need us the most. Now, in these uncertain times, we want this safety net health system to be a beacon of stability, where patients know, as Dr. Cerise said, that they will receive the highest of quality, the highest of compassionate care, where access continues to grow but doesn't retreat. Because the next chapter isn't about making sure your zip code doesn't determine your health, right? It's about making sure that wherever you are across Dallas County, you can receive the best of care. Because every investment in Parkland is an investment in children. It's an investment in families. It's an investment in neighbors who deserve to thrive. In a time of shrinking federal and state funding, we know that philanthropy will continue to be even more vital than it has already been in helping Parkland bridge gaps, promising our patients that care is never, never compromised. And we want you to be a part of that precious and exciting story. Now, I wouldn't be doing my job if I didn't talk about ways that we can continue to be activated in this journey together. You will see a QR code on the screens that will allow you to sign up for a tour, right? We all know that proximity matters. It's important to be connected to our spaces and individuals. And so we are excited across the Parkland Health Foundation team to allow you to experience how your giving is truly impacting the future of healthcare and public health across Dallas County. We'll be hosting small group tours and a few select dates. And I can tell you, it's one thing to hear about Parkland, and we heard some great testimonies about the work that we've done together, but it's another thing to walk the halls, to meet the people whose lives are being changed, and to see your impact up close and personal. So I encourage you, come along, join the party, sign up tonight. Now, before we close, I want to take a moment to thank our sponsors. Genentech, our platinum sponsor, please join me in thanking them for stepping up. Our gold sponsors, Bank of Texas, Children's Health, Dallas Regional Chamber, Parkland Community Health Plan, Southwestern Medical Foundation, and UT Southwestern. Thank you so much. And our valet sponsor, Park Place Dealerships. Amazing. Your leadership and generosity have made this event possible. And most importantly, you've helped amplify and enhance Parkland's mission in ways that truly ripple throughout our community. We are deeply grateful. We are grateful as well to the patients and staff of the Moody Outpatient Center who have so graciously shared this beautiful and dignified space with us today. And so I want to thank them as well. So here's my ask to you tonight. As Dallas County residents, as neighbors, as partners, please continue in this journey with us. Tell Parkland's story. Take a tour. Help us bridge those gaps that still exist in our community. Be a part of the solution. Because when we come together with care, compassion, and community, there is no limit to what we can achieve together. Thank you so much for your time tonight. Thank you for joining us in this journey. Please enjoy the rest of your evening. God bless you. Thank you. Good to be back.